Relyvrio is used to treat a certain type of nerve disease called amyotrophic lateral sclerosis. This medication contains two drugs, sodium phenylbutyrate and taurursodiol. It helps slow down loss of physical function due to this disease. However, it is not a cure for amyotrophic lateral sclerosis, and it does not resolve nerve damage or muscle weakness. How to use. The recommended initial dosage of Relyvrio for oral suspension is 1 packet daily for the first 3 weeks. After 3 weeks, increase to the maintenance dosage of 1 packet twice daily. Preparation and administration. Empty contents of 1 packet in a cup containing 8 ounces of room temperature water and stir vigorously. Take orally or administer via feeding tube within 1 hour of preparation. The reconstituted suspension may be stored for up to 1 hour at room temperature. Discard any unused Relyvrio reconstituted suspension after 1 hour. Precautions. Drug interactions may change how your medications work or increase your risk for serious side effects. Keep a list of all the products you use, including prescription, non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Side effects. What are the possible side effects of Relyvrio? Relyvrio may cause serious side effects, including changes in bile acid levels. Relyvrio may increase bile acid levels and cause vomiting and diarrhea if you already have problems with your liver, bile ducts, or pancreas. Your healthcare provider should monitor you for the side effects. Some disorders of the pancreas, bile ducts, or intestines may also make it harder to absorb Relyvrio. Salt, sodium retention. Relyvrio contains a high amount of salt. For people who are sensitive to salt intake, such as people with heart failure, high blood pressure, or kidney problems, limit the amount of salt you eat and drink. Talk to your healthcare provider about the total amount of daily salt that is right for you. Your healthcare provider will monitor you for signs and symptoms of salt retention during your treatment with Relyvrio. The most common side effects of Relyvrio include diarrhea, abdominal pain, nausea, upper respiratory tract infection.